It all began that afternoon in April 2016. My husband and I took our son, Robbie, out to dinner in Willimantic. He's a student at Eastern Connecticut State University. That was the day that changed everything.
So, what's up at college?
Well, I mean, we know Eastern has a pretty good economics program, right? Recently, I've been looking a lot into philosophy. Actually thinking about possibly changing my major.
Oh, great. I heard the philosophy factory's hiring. Honey? Janet?
Mom, you okay?
Remember the call came in around 7:30 p.m. 48-year-old female, chest pain, possible cardiac distress. We were dispatched to the Willimantic Brewing Company on Main Street in Willimantic. We got her condition stabilized and rushed her to the emergency department at Wyndham Hospital.
Janet was showing signs of a severe cardiac event. After evaluating her and reviewing her medical records, we made a decision to immediately transfer her to Hartford Hospital via Lifestar.
We safely transported Janet from Wyndham Hospital to Hartford Hospital. She was in good hands thanks to our skilled crew.
I suppose triple bypass surgery is never really routine, but this was not unfamiliar ground for us. We took great care of Janet, and she came through the surgery just fine, and to the great relief of her boys, as she called them.
While Janet was in surgery, I had checked her records and noted that she had high blood pressure and type 2 diabetes. So when I saw that her blood sugar levels were elevated, I called down to endocrinology.
The endocrinologist adjusted her insulin levels and told us to closely monitor her blood sugars.
I also updated Janet's electronic medical record so her primary at the Hartford Medical Group could stay in the loop.
I was the primary nurse to do her initial assessment. I took the time to review the plan of care with Janet, her husband, and their son Robbie. I called in the dietitian for a consult to start a nutrition plan. She would also be following with the dietitian at the Hospital of Central Connecticut.
Given Janet's cardiac condition and diabetes, we recommended that she spend 3 days recuperating at Southington Care, just until she gets her strength up.
And when Janet finally does go home, I have made a referral at the VNA. A telemonitoring system would also be in place at her home for constant updates of her vital signs and her symptoms.
All that was left before Janet could leave was to schedule follow-up visits with the cardiac surgeon and her primary.
And don't forget updating her medical records with the discharge summary.
Right, then it was goodbye, Janet.
Good luck.
We'll be right here if you need anything.
Well, things were going pretty well with Janet at home. Until about a weekend, I saw through the home telemonitoring system that she had developed some shortness of breath, so I rushed over to do an assessment and immediately called her surgeon.
Janet's change in status was cause for concern, but not totally unexpected in cases like this. I adjusted her medications and sent a request for blood work to a clinical lab partner center near her home in Plainville. Then during our follow-up, I recommended she begin cardiac rehabilitation at the Hospital of Central Connecticut, which is also near her home.
Today in the Farmington Valley, both Hartford Medical Group physicians and the doctors of Central Connecticut see patients who are treated at Hartford Hospital and the Hospital of Central Connecticut. We give the patients their preference. I'm part of Hartford Medical Group's patient-centered medical home. I've been Janet's physician for years. I've been able to keep track of her progress electronically and by talking to her other providers. After a little discussion, I got the feeling something was wrong. With a little more prodding, I found out that Janet was depressed and anxious about her condition. I was able to get her to attend the cardiac support group at Midstate Medical Center, which is close to her home. She's doing much better now.
Janet told her doctor something else too. I got a call from him here at Eastern Rehabilitation Network. Apparently, Robbie was having such a tough time at school. He was so stressed about his mother's condition, he developed severe headaches. I managed to fit him in for treatment with me in his off days.
It also made Janet feel better to know she had even more support at the Institute of Living if she so required it. I offered to help refer her to the stress management clinic right here in our Avon office.
All the therapists here in cardiac rehab were really pleased with Janet's progress in the program. She did really well. But let me tell you, she's an animal on the bike and the treadmill.
As a dietitian, I realize how difficult it can be to change bad habits, but Janet took to her food nutrition plan we worked on together. She's done really well. She's lost 10 pounds and her diabetes is under much better control.
I'm not what you would call a healthy eater. I would put gravy on my salad if it was socially acceptable. But I love my wife more than I do pizza. So I'm doing the diet thing with Janet. We've even joined a wellness center together. And check this out. I've even lost a few pounds myself.
Oh yeah? So I think I just found him. No, I'm just kidding. You both look great. Anyway, I started feeling a lot better myself. Even took a few of those stress management classes over at Wyndham Hospital. And it really helped me. I went with Mom to her latest cardiology appointment. He's happy with her progress. I gotta say, I like the prognosis myself.
You like the prognosis, did you? What are you gonna do? Major in pre-med now?
Hey, maybe. You never know.
A lot better than philosophy.
I can't believe it's been 6 months since the heart attack. I was so scared then. But to go through that, to get to how I feel now, it was almost worth it. Because I feel better than I did 10 years ago. I look better too. And I haven't called into work sick in forever. To think, we used to try to manage all this health care ourselves. I don't know how we would have done it.
Hey. You know, it's amazing. All of the help we needed. All the help that we got, for me and the boys. It was just so smooth, just right there. I don't know. Made me feel just really cared for.
How do we ensure that every patient who comes to Hartford HealthCare receives the same, highly coordinated, consistently excellent patient care that Janet received? It begins with you, it begins with me, and it requires every member of the Hartford HealthCare family to participate to ensure that this happens. It happens through patient engagement, actively engaging patients in their care decisions and ensuring that we are organizing ourselves around the patient's need. It happens through information, making sure that the information is where the information needs to be, when it needs to be there, to inform our clinicians' decision-making in a timely and effective manner. It happens through patient navigation, as we build the systems to coordinate care across the continuum for patients, and we partner with them to help them navigate through the complex organizational systems of Hartford HealthCare and other healthcare providers. And it happens through standardization, reducing the wide variation in the process of care and the outcomes of care that our patients receive by using evidence-based medicine, established pathways and protocols to ensure standard excellence in everything we do. We are working together like a family across all of Hartford HealthCare to ensure that Janet and every patient who comes to our organization receives this kind of care. We are using our H3W framework as the foundation to install the capabilities to be sure that we can deliver on the promise of our vision, to be nationally respected for excellence in care that we deliver, and to be most trusted for personalized, coordinated care. That is our ambition, and that is our promise to Janet and all the patients who come to Hartford HealthCare for their care. Thank you.